Good morning, everyone. Bonjour tout le monde.
Good morning, everyone.
Since the first major flight we organized to bring Canadians home from overseas. When we were coordinating emergency repatriations last winter, our priority was doing whatever it took to keep people safe. And from that moment right through to today, that continues to be what we're focused on. From border measures to vaccines to rapid testing to the wage subsidy, we're using every tool in the toolbox to get us all through this crisis. Let me start with some news on border measures. As of February 15th, when you return to Canada through a land border, you'll need to show a 72-hour PCR test, just like for air travel.
Next Monday, February 15th, when you return to Canada through a land border, you'll need to show a 72-hour PCR test, just like air travel.
I also have some news to share on vaccines. This week, tens of thousands of Pfizer vaccine doses will be delivered to Canada. This is good news for so many people who will be getting their dose. We know we all want to feel that relief of getting vaccinated, of watching our loved ones get vaccinated. We're all eager to know when it's going to be our turn. Well, I can tell you we are still very much on track for tens of millions of doses into the spring, and for everyone who wants to be vaccinated by September. Moving forward in the coming weeks and months, we're going to get even more doses, even faster, so we can all move through this together. Next week marks the start of a major ramp-up in vaccine shipments. Starting on the 15th, we're expecting hundreds of thousands more doses each week, and that's just from Pfizer. There are also other vaccine candidates currently in the approval process, and the top experts at Health Canada are working around the clock to ensure that any of these new vaccines approved is both safe and effective.
We have already administered more than 1 million vaccines to fight COVID-19 in Canada. These essential doses were administered to your parents in long-term care centres, to your friend who is a nurse, or to your neighbour who is a personal support worker. And this is just the beginning. We will continue these efforts until every Canadian who wants to will receive a vaccination. This week, tens of thousands of additional Pfizer doses are arriving, and several other million are coming. With respect to the vaccinations, things are on track despite some temporary delays. We will be receiving 20 million doses from Pfizer and Moderna over the spring. Other vaccine candidates are being approved. Health Canada experts are working very hard, and you can be sure that every vaccine will be approved, that is approved, will be safe and effective. I can reassure you that you and your family will be vaccinated by September. But even though everything is on track when it comes to vaccinations delivered to Canadians, we're not yet out of the woods. By keeping your distances, by washing your hands and wearing the mask, you can continue contributing to the efforts to fight COVID-19. We cannot ease up.
I also want to talk about where we are with testing. Rapid testing is key to keep under control, especially in schools, long-term care homes, and workplaces. Last Friday, this is something I spoke about with Dr. Janine McCready in Toronto. She and her team have spearheaded an innovative testing program at several schools, getting tests directly to communities that need it. In some neighborhoods, she told me that as many as 1 in 5 tests, that's 20%, come back positive. Clearly, there's real need for this testing. Her work shows that when people can get screened for COVID-19 and then get their results quickly, we can stop the spread. And this is true right across the country. Here in Ottawa, a recent program to test asymptomatic students and their families found several positive cases. Since they weren't showing any symptoms, without testing, these kids would have been in a busy classroom. But because of ramped up testing, their families knew to isolate at home instead. Testing widely and often reduces transmission. That keeps cases down and it keeps people safe. Our government has sent 19.6 million rapid tests to the provinces and territories, with more on the way. We all want to see cases go down. We know that these tests can make a difference. Tests must be deployed. They can't be allowed to expire. And testing, like more contact tracing and vaccines, are going to be an essential part of the months forward as we get past this virus and this pandemic as quickly as possible. We all need to keep working together on all these different aspects to make sure we get through the summer in right form.
In addition to talking about the need to use rapid testing during our regular meetings with premiers, we're now working with the private sector to deploy these tests in the workplace throughout the country. Testing is effective, and we want to ensure that the rapid tests are used. These essential tools will help us get through the months of winter and go into the spring mass vaccination period in the best condition possible.
We'll look forward to spring this year more than ever. But I know we can all agree that there's one part of the season nobody likes: tax filing. Even so, it's important to file your taxes so you get things like the Canada Child Benefit, the Work From Home deduction, and the Climate Action Incentive. These benefits and credits can really help, especially after such a tough year. So that's what you should be able to focus on. Right now, I don't want you to have to worry about what you may owe in taxes. That's why we're providing 1 year without interest on certain 2020 tax debt, giving people more flexibility to repay amounts owing from last year. If you received federal emergency benefits, like the CERB, and you made up to $75,000 in taxable income, you will not have to pay interest on 2020 tax debt until April next year. Our priority is ensuring that you and your family get through this pandemic and back on your feet.
This past year has been quite difficult for those who have lost their jobs or those who have had their hours reduced. We want you to get back on your feet without having to worry about the tax you need to pay. Last year, more than 8 million people applied for the CERB to pay for their rent and put food on the table. I know that some individuals have pointed out some inaccuracies in the information pertaining to the net and gross income requirements to get the CERB, but we're going to clarify the question. People who applied for the benefit based on their gross income rather than on their net income will not have to return the payments that were paid to them, providing that their application also respects the other eligibility criteria.
CERB based on their gross income instead of their net income. As long as you meet the other eligibility criteria, you will not have to return those CERB payments. When we rolled out CERB last March, it was because people needed help in the face of a global, once-in-a-generation crisis. Well, the pandemic isn't yet over, so neither is our support. If you need help while you look for work, the Canada Recovery Benefit and Enhanced EI are there for you. If you need to take time off to care for your family, look to the Canada Recovery Caregiver Benefit. If you need to stay home from work because you're sick, the Canada Recovery Sickness Benefit is there to help. And if you need support on payroll for your employees or costs for your businesses, the wage subsidy and business loans are made for you. It's not easy to run a business from home or adapt to new public health rules. Yesterday, I spoke with Karen and Fahie. They're two young Black entrepreneurs who have big plans. Karen showed me her photography studio and talked about the great work she's doing supporting Black-owned businesses and products, and her excitement about moving forward to a bricks and mortar storefront as we move through this pandemic. But right now, she's all online. And Faye talked to me about the costs of shipping coffee across the country and his excitement about building his business and also moving towards opening a coffee shop once we get through this pandemic as well. They all have big plans. And for all the young entrepreneurs across the country, all the entrepreneurs who are looking to go digital, to change their way of doing things, to grow through this pandemic and beyond, know that we are there to help you get through the hurdle and create success, not just for you, but for employees, for community, and for our whole economy. We're here to support Canadian business owners, from training on e-commerce to targeted initiatives like the Black Entrepreneurship Program and the Women Entrepreneurship Strategy. Because no matter who you are, an entrepreneur, a worker, a parent, we've got your back. Cette pandémie.
This pandemic is not easy for anyone. Moreover, winter can make this all seem more difficult. During February, sometimes we have the impression that spring will never come. It's understandable that we not feel that we're in top shape, but don't forget, we do have resources to help you. And moreover, this Thursday, this is the National 211 Day, which reminds us that everyone has access to a confidential distress line, toll-free by dialing 211. Whether you need help for mental health or if you need information about community services, don't hesitate to dial the number. The service is provided 24 hours every day in 150 languages. The agents at the other end of the line will help you find the proper resources. You're not alone. So please, ask for help. Take care of yourself.
Close, I'd like to take a moment to recognize a great public servant, Ian Shugart, the Clerk of the Privy Council. Ian has been an extraordinary leader through this public health crisis. He's leading the public service in tremendous efforts and supports to get Canadians through this pandemic. And as he faces health challenges, I want him to know that we're all pulling for him. Merci beaucoup tout le monde.
Thank you, everyone.
Our minister, starting with the phone today. Opératrice, une question, une sous-question. C'est à vous.
Thank you. The first question, Althea Raj, your line is open.
Good morning, Prime Minister. Your government has responded to federal whistleblowers who broke the law by leaking information to the public about what was happening in places such as Rideau Hall and in some long-term care homes. I don't think most Canadians realize that the whistleblowing law actually prevents whistleblowers from speaking publicly, that if they talk to journalists to flag wrongdoing, they can be fired for doing that, and that that is legal. 4 years ago, your own government, your own MPs rather, told your government that the law needed fixing and that it should be expanded to encourage more workers to come forward and flag wrongdoing so that corrective steps could be taken. Although you promised to do something, nothing was done. Now that you've spent hundreds of billions of dollars and more than 20,000 Canadians have died, will you expand the whistleblowing law in order to protect and flag whistleblowers and to flag wrongdoing?
It's extremely important that every Canadian has a safe and secure workplace, free from harassment or other challenges and inappropriate behavior. That's why we've taken significant measures to strengthen processes and procedures in supporting anyone who comes forward with concerns. We also know that whistleblowers play an extremely important role in flagging how government can do better. And indeed, the level of transparency and confidence a government can give Canadians in constantly improving, constantly doing better and sharing what we need to do to improve is something that we've always been committed to. I look forward to continuing to work with all parties and members of the public service on strengthening measures to make sure that this government is always open about what's going wrong and how we can fix it.
Following up, Althea?
Yeah, I feel like you constantly say the right things, but your government's actions don't follow through on the words that you say. Why won't you fix the law if you acknowledge that it is too restrictive?
We're always looking to improve structures and systems within the government, and I thank you very much for bringing forward these concerns. Like we have many MPs and Canadians bringing forward these concerns. We're going to continually look to improve structures to make sure that what we're doing for Canadians is being done right, is supporting Canadians throughout this pandemic and beyond. I made a simple promise at the beginning of this pandemic that we would have Canadians' backs. And through listening to MPs, to Canadians who come forward with gaps or challenges that they're facing, we've done a tremendous amount to improve the supports for Canadians right across the country, and we will always look to continue to do that.
Thank you. Opératrice, prochaine question au téléphone.
Merci. La prochaine question, Catherine Lévesque, La Presse canadienne.
Question, Presse canadienne. Good morning, Mr. Trudeau. I'd like to go back to the issue of land borders. Will Canada refuse to let snowbirds to re-enter the country if they don't have a test? No. Answer, no. It's not legal for Canada to refuse entrance into Canada from someone who has the right to enter, who is a Canadian citizen. When they come to the border in Canada, they are already on Canadian territory. We cannot send them back to the United States if they are Canadian or if they are permanent residents. However, we can apply severe penalties if they don't have the test. We can require extensive follow-up by Health Canada, but the vast majority of people are going to do what is needed, get a test when they get to the border, and so that they can go to their return home for their quarantine period.
To refuse entry to any Canadian who wants to come home. And that's something that is the major difference between land borders and air borders. You can prevent someone from boarding a flight in Miami or elsewhere. You can't prevent someone who's standing at a land border crossing from entering Canada because technically they're already on Canadian soil when they're speaking to that customs officer. That's why what we can do is, in cases of no test to show, apply a stiff penalty, a fine, and demand and ensure a rapid answer that they are getting tested, that they are being properly quarantined, that they are not putting at risk the safety of other Canadians by returning home without a clear negative test. These are measures we're putting forward, but as of next Monday, people who show up at a Canadian land border on non-essential travel will be expected, like returning snowbirds, will be expected to show a negative PCR test from the previous 72 hours.
En suivi, Catherine?
Follow-up question. Can you tell us what type of penalty or fine will be applied? What will be the consequences for a Canadian who does not have a mandatory test? Thank you. First of all, we need to understand that non-essential workers who take the plane represent about 15% of travelers who are coming back into Canada by plane, but the non-essential workers through our land borders represent about 5% of the people. The vast majority of people who cross our land borders are essential workers, truck drivers, nurses, those types of people. So for this small proportion of people who do go through our land borders, if they don't have a negative test, there will be fines that will go up to $3,000 per person. There will be measures that we are going to be implementing to ensure that there is follow-up on these people to ensure that they are not putting other Canadians at risk by coming back to Canada.
Thank you. Merci. Our last question, Hélène Buzetti, Le Devoir.
Le Devoir, question. Good morning, Mr. Trudeau. You said that we could be dealing with fines up to $3,000 per person. Do you think that these travelers will be put into supervised hotels? And what why don't we have any dates set? When people come to an airport when they arrive back here in Canada from overseas or abroad, if they show that they don't have an adequate quarantine plan, we already have locations where they can go and self-isolate if they cannot do their quarantining at home. We already do have systems in the major airports to look at these possibilities. Obviously, we're going to be working to ensure that these mechanisms for our land borders apply as well. We will be announced at one point, but I would wanted to give people advance notice, telling them that as of next Monday, if you cross a land border and you're going to have to show that you have a negative PC test. As for the other measures, and including the measures in the airports, we will be making further announcements in the next few days. We are ensuring that Canadians are going to be well protected. Follow-up question, going back to this CERB issue and the fact that people don't have to reimburse. A lot of people said that right at the outset they didn't apply for the CERB because they had understood the rules correctly. They did understand about the gross and net income requirements. I feel that these people are going to be treated unfairly, in fact, that they didn't apply for a CERB. There will be no retroactive measures. We're here to help people who made a mistake because of a lack of clear instructions. We don't want to compel them to reimburse, and we have introduced a wide range of benefits to help people out, but our eligibility criteria were set.
Canadian Press. I want to ask about, get some thoughts on vaccine nationalism from you. That concept. The U.S. has invoked its Emergency Defense Act. Europe is reportedly putting some strict controls over the export of certain vaccine ingredients. This obviously has implications for Canada and our supply. I mean, how can these actions not have a negative impact on the flow of vaccines to Canada? What can you say to Canadians who might be wondering about this?
We worked very hard from the very beginning of this pandemic to secure a diverse portfolio of vaccines for Canadians because we knew there would be challenges. We saw challenges in the spring around PPE and the competition internationally for that, we would be well advised to ensure both a diversity of origins and sources and types of potential vaccines, as well as sufficient doses to ensure that we would be able to cover all Canadians in various different configurations, depending on which companies landed effective vaccines first. Obviously, we continue to work with partners around the world. We understand the pressure that every government is feeling to vaccine as many of their citizens as quickly as possible. We're certainly working every single day and night, to make sure we're getting as many doses for Canadians as possible, and we'll continue to. And indeed, we're going to see millions of doses arriving in the coming weeks and tens of millions in the coming months. At the same time, through this pandemic anywhere until we get through it everywhere. It is a global pandemic, and that's why Canada, while at the same time as we are procuring vaccines for Canadians in a priority way, we are also participating fully in initiatives like COVAX and other international initiatives to ensure that we are supporting the developing world who need access to vaccines as well.
Glenn McGregor, CTV News. Prime Minister, Toronto's top public health officer has said we're entering a new pandemic now because of the emergence in the province of variants from South Africa, Brazil, and the UK. And yet the Premier is moving ahead with economic reopening, starting even this week. Asking you not as a Prime Minister, but as a resident of Ontario who sends his kids to school here, are you comfortable with that decision to begin reopening now when we're still facing all these variants and potentially a third wave?
I think we're all worried about the arrival of new variants and the impact that that could have, even as we are working hard to get everyone vaccinated as quickly as possible. There are real questions about what the impacts these variants will have both on the spread of COVID-19 and on the impact of the vaccines. That's why while we work on vaccinating people as quickly as possible, we also need to add to that public health measures, which means restrictions in many cases, but also means things like contact tracing, means things like using the app and expanding it to use QR codes, moving forward on rapid testing very efficiently so that wherever we see outbreaks, we're able to isolate those and respond quickly. We're going to need to be extremely nimble as we move forward on a reality of new variants that's going to require all of us to continue working together, to continue working to get vaccines in as quickly as possible, but also making sure we're keeping up to date on the testing, the contact tracing, and everything each of us individually can do to keep ourselves and our loved ones safe.
Steve Chase with the Globe and Mail. I have a question about the reporting we did about this company, which is operates the Visa Application Center for Canada in Beijing. It's actually owned by the Beijing Police, the Public Security Bureau. And now this Public Security Bureau, of course, has quite a reputation. It's been accused of torture by human rights critics. But more importantly, what will you do about this? Will you allow this to continue? And what would you tell Chinese nationals seeking to escape China about the safety of applying for a Canadian visa at a visa application center run by the Beijing Police?
First of all, we take the security of all applicants and the privacy of all applicants extremely seriously. And when we contracted out with a global company that does visa services around the world, we ensure that it is able to keep Canadians and applicants' data private and secure. Indeed, when they further subcontract to local offices and local companies, that is something that we continue to demand. But in the case of this particular local office, I can tell you that a number of other countries also use this local company, including Great Britain and New Zealand, who are both our Five Eyes companies, Five Eyes allies. We of course, take these reports extremely seriously, and I've asked the Minister sure that we can guarantee the safety and integrity of our visa systems for all applicants.
Hi, Prime Minister. Tom Perry, CBC. We've heard some reports out of Calgary about travelers being kept in quarantine hotels, not getting enough food, being denied medical access. I'm wondering what you think about that. Are you worried that these kind of reports feed into conspiracy theories about government internment camps, things like that? And also, how do you ensure Canadians, as you move to set up this 3-day quarantine, that they're not going to be essentially held in prison?
I think it's extremely important to make a clear distinction that these aren't detentions. These are medically based isolations. On the 3-day quarantine, for example, that is the average time for a PCR test to be returned. It's the expected amount of time in which a returning traveler might have to stay in the approved local airport hotel. But indeed, if it only takes 24 hours to get that PCR test back and it comes back negative, they are going to be free to go home and continue their quarantine as mandated at home. We are not detaining people. These are public health measures that are necessary to ensure that we are keeping Canadians safe, particularly given the arrival of new variants in Canada and extensively around the world. We need to do everything we need to keep people safe. We need to do that in a way that is respecting people's dignity and supporting them properly. And I can assure you that everyone is following up carefully to make sure that the conditions in which people have to do their quarantine or their testing are always adequate.
En français, s'il vous plaît, Monsieur Trudeau.
I think it's important to understand that the measures we have implemented, such as the 3-day wait period for test results, this is not a punition, punishment. They're not. These people are not in detention. They have to isolate until they get test results. Normally, it takes about 3 days to get the results, but should the person receive results after 1 or 2 days, they're free to go back to their homes to continue their quarantine with follow-up. But we're not there to detain people. We are there to ensure that the public health regulations are followed and that everyone is kept safely. I can assure you that Health Canada and the Public Health Agency of Canada view the need to treat everyone with dignity, and we will always provide follow-up to ensure that this is the case. Radio-Canada question. With respect to the CERB, you're going to give people more time to pay back these benefits, but this was emergency relief for people who were in need. Just by delaying this reimbursement, do you think that will help? Do you think we'd be better off just canceling it? For those who are the most vulnerable, the most in need, they won't have much taxes to pay. Anyway, the CERB was not put in place for people who were the most vulnerable. A lot of people applied for CERB, and they will have the means to pay taxes in the months that lie ahead. We are always worried about equity for everyone, and we want to take ability to pay into consideration. But a lot of people applied for CERB. That's understandable. Some people will be paying taxes on it. Same thing for employment insurance.
We put forward measures to help people who are in difficult situations, and the CERB is there to help. Was there to help people who were facing no revenue coming in because of the pandemic, and that was extremely important at that moment. But the CERB wasn't only taken up by low-income Canadians. Obviously, if you're extremely low income and you took the CERB, you're unlikely to be having to pay much in the way of taxes come tax time. But for many people who took the CERB because they needed it in the moment, but then went on to get back to their job, back to work, and are in the income range where they're used to paying their fair share of taxes, the CERB will be taxed. It's about making sure that it's fair for everyone. We tax revenue, we tax income related to employment insurance, for example. The CERB is there as a income replacement measure. Some people will not have to pay taxes on it if their income is low enough. Many others will need to pay their share of taxes. That's just how our system works. But we are giving an amnesty on people on the interest payments on repaying their CERB taxes, because we know that we're still going on in this pandemic, and it's a tough time for everyone, and we want to be able to support people as best we can.
Prime Minister Mike Couture with Global National. On the allegations facing General Jonathan Vance, the Office of Defence Minister Harjit Sajjan says it notified the Privy Council office of concerns about Vance's alleged behavior. So first I wanted to know, is that enough? And Canadians want to know what you knew. Did Defence Minister Sajjan at any point raise concerns with you about General Vance's behavior towards female subordinates? And I think Canadians just want to know what you knew.
First of all, Canadians know that everyone, whether they're in the armed forces or working for the Canadian government or in any workplace across the country, deserves to be in a safe workplace free from harassment or in unacceptable actions. That is something that we take very, very seriously as a government, which is why we've brought in strengthened processes over the past number of years and have absolutely no tolerance for these sorts of behaviors. We have brought in place procedures that need to be followed and needed to be followed in these cases. And we are very pleased that there is going to be a review going on to ensure that every step of the way the right processes were followed. That's something that will be looked at right now, but I can assure you that we've always taken these very seriously and ensured that those proper steps are followed.
Thank you, Prime Minister. C'est ce qui met fin à la conférence de presse d'aujourd'hui.
Merci tout le monde.
Thank you, everyone.